most famous physical therapist on the internet.
Howdy, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we get the question sometimes, Brad. I want to massage my knee because I'm having some knee pain.
Right.
The thing you don't want to do is you don't want to take a massage gun or a massager and go right on the knee itself.
The bony part you
Right,
mean? Yeah.
right. That's just going to irritate it.
Exactly.
With massage, you want to go upstream and downstream. In other words, above the knee and below the knee. These muscles greatly affect what is happening at the knee.
They're all connected, Bob.
Yes, they are. So we're going to start with the quadricep, and you can manually do this if you want to. You can massage this muscle. Quite often, the problem with this muscle, it's tight.
It's big too.
It's become tight over time, and yeah, you can use a lot of different things to do so, but the best thing is a massage gun, Brad, right?
Yeah, they do work well, and they're very popular for a good reason. It's because they take the load off your hands. I can massage a part for maybe a minute before I'm getting tired.
Right.
But with this,
especially when you're dealing with big muscles like this, maybe in Brad's case, not that big, but
yeah, they're kind of fading away as I age. But here we got different heads.
Right.
You have to be aware of that. We got 5 of them. We got this one's on there.
And part of the reason we're pointing this out is because we are giving away one of these massage guns this week, the T2.
T2.
That's the T2.
R2T2.
That's right.
And it's pretty funny.
Really, it's a powerful gun.
Yep.
And it's got 5 heads, like we mentioned. We'll show you them.
I got the soft airhead on there, and with that one, you can get approached close to the bones, and if you do, it's not going to hurt.
We'll talk about that next, Brad.
Oh, I'm sorry. I'm jumping the gun. You want me to
jump in the gun?
Get it? I didn't even try on that.
Right. But first off, again, the quadricep on a lot of people is tight, and you want to make sure. If it's tight, it's going to pull on the kneecap harder than it should, which will compress on the knee harder than it should. So,
and Paul reminded us last week, the professor, he said, there's that retinaculum fibers that also
are really sensitive too.
Yeah.
They're really pain sensitive. So another problem, and this is the problem I had, Brad.
Yeah.
On both knees I had it. Right where the quadricep attaches into the kneecap.
Sure.
There's a tendon right there. And this got really flared up on me. On both sides, I was doing split squats.
Yeah.
Well,
you got to be careful, Bob.
Right.
At my age. We're not 25 anymore.
So I tried all these things to get rid of the pain. Nothing worked, Brad. I mean, all these PT things.
Yeah, things and this was a couple years ago, right?
Right.
We were just starting to get into these things.
So I tried a massage gun. And
show them what you did.
I even took it to the point where I would go right to the edge of the kneecap.
Yeah.
I would run along the kneecap a little bit. This thing reduced it by 80%, the pain, within 2 days.
How many weeks?
2 days.
2 days.
It was amazing. Yeah.
So
I was shocked.
Maybe you weren't getting close enough with your other techniques, whatever.
I don't know. I was using my hands. I was also doing eccentric strengthening.
Oh, yeah. Yeah.
But either way, it didn't work. And that worked very fast. So the other thing, Brad, besides the tendon, underneath the tendon, there's a suprapatellar pouch. Supra means above the kneecap.
Yep.
So in there, they have the synovial fluid.
Yep.
And they can get bound down. So you want to do the same thing. You want to massage it.
Yeah.
So if it's a tendonitis or if it's suprapatellar pouch, either way,
you get the same structures. It's 2 for 1.
So number 3, you want to maybe work the hamstrings.
I put a different head on because that's what I like to do.
The hamstrings, all 3 muscles cross the knee. If they're tight, they can put stress on your knee.
Yeah. So and this is one where I put this head on, and then I'll go on my clothing because it's slippery and it really works well in the hamstrings. And this is options you'll learn after you work with one of these guns.
All right. The next one, Brad, number 4, is actually the IT band. Now, this is going to be for a specific knee problem.
Sure.
If you're having pain on the outside of your knee, especially with biking or running, kind of repetitive type injuries,
Yep.
you're going to want to massage along the IT band. Now, you're not going to stretch the IT band, but quite often the IT band is bound down. It's adhesed down,
Yep.
and this will help loosen that up.
And for this, I like to use the round head.
Sure.
Yep. And because if you go directly on the IT band, it may be a little uncomfortable because the femur's right
Sure.
underneath it. So you're going to have an angle. This is a little trick. And now the clothing gets in the way. So sometimes it's best to do it with it on, depending on what you're doing there. There we go.
Well, Brad, let's do this next one too, since you got the round head on there. Let's say you have pain in the tendon underneath the kneecap.
Yeah.
That's called the patellar tendon.
Infrapatellar, isn't it?
Yeah.
Below the
And
patella.
it's from jumper syndrome or
Mhm.
jumper's knee.
But you don't have to be a jumper for
No.
it. But yeah, it happens right there.
And Brad uses the round head and he goes at it from a side angle
Yeah.
and he gets a great crossfire massage on there.
Yeah, it's so bony there, as you know, if you go directly into it, you're going to make it worse.
Right.
So you need to approach it. This is probably about the only option.
Yeah, it really is probably. I think the only head that'll work on that
Yep.
tendon.
And then going at it at an angle
Right.
like this.
Right.
And you can really adjust your force and pressure and intensity.
All right, the final one is, I don't know, I was hesitant to even say this one, Brad, because I don't know if it has that much of effect, but the calf muscle does cross the knee,
Yep.
especially the gastrocnemius.
Mhm.
And so it doesn't hurt to, what do you do?
I don't know. I thought you do your calf a lot
Yep,
more than I do.
yep.
My calves are
I
pretty,
use the bullet head actually.
yeah.
And I think if you keep that loosened up, you gotta make sure there's no stress coming from the inferior part of the knee.
Right. Yep. So that muscle there, I don't know if this is a major part of the problem, but it sure seems like it.
I would start with this.
Right.
I
I
was-
mean, between Paul, you and I, the three therapists in the last 2 weeks talking about knees,
Right.
our experience says this is much more common than
If you want, you
below.
can go that far down, but I think in most cases this is going to take care of it. So,
exactly.
all right, there you go.
My knee feels a lot better already, Bob.
Yeah.
I'm telling you.
I wonder if it's a little placebo there. All right,
What'd you call me?
placebo.
Oh yeah.
All right.
Be
Thanks for
careful.
watching.